in March this year, a group of bow tie specialists gathered together to produce that was aligned to the EI stroke CCPS bow ties book. Subsequently, that group of bow tie specialists revised the bow tie and republished it on the 9th of April 2020. And that was in response to some feedback from industry. The primary objective of today's webinar is to explain the construction of that bow tie, having first reviewed the rules for developing a bow tie. Without further ado, I'd like to introduce the first speaker today, who is Charles Cowley. Now, Charles is an experienced engineer and manager with a particular interest in leadership and safety. He had a 27-year career at Shell and worked on major projects, asset integrity and safety, is an advocate of the Hearts and Mind Safety Culture Toolkit, and also developed the Shell HSSE control framework. After retiring from Shell, he's worked as a consultant for a number of organisations, including RiskTech, Arup, Shell, the UN Environment Programme, and the European Commission Major Accident Hazards Bureau. He also runs a training course for IChemE on engineering project manager. But for about the last 8 years, he's been a staff consultant with the Centre for Chemical Process Safety, or CCPS, and he's been delivering training and also supporting industry groups that are developing safety guidance. And the particular one of relevance to this event today is the so-called Bow Ties book. He also has been working on a project to develop Process Plant Operations Human Factors Handbook, which is expected to be published next year. So in his presentation, as per the title, he will give an introduction to bow ties and their use, and briefly introduce the COVID-19 bow tie, which is jointly published by EI and CCPS. So over to Charles, please. Thank you.
Yeah, well, thanks, Mark, for that introduction. Yes, I'm Charles Cowley. I'm here representing the Centre for Chemical Process Safety. The CCPS, briefly to explain, is an industry association. It's part of the American Institute of Chemical Engineers, but is really an international organization with offices in Europe and Asia, as well as the Americas. And we've been working in collaboration with the Energy Institute on a couple of projects in the last few years, which Mark just mentioned, one particular on bow ties. So my part of this webinar is to explain a little bit about what bow ties are, mention and talk about the book that we published 2 years ago, and then briefly introduce the COVID-19 bow tie, which is the main subject of today, which my colleagues will explain in more detail. Now, bow ties have been around for quite some time, and a good bow tie diagram summarizes how a hazard is managed in one understandable picture. It's shaped like a bow tie, creating a clear differentiation between the proactive prevention side and the reactive mitigation side of risk management. It's been very successful in helping people understand and communicate risks, and is used for many, many risks outside the process industries, but also very much also in the process industries. And it really does help people understand and manage the barriers that keep us safe. It's now widely used by many companies, many organizations in different fields. But there have been some problems traditionally with using bow ties. They get very complex, and that doesn't do the job of communicating risk management very well. And there are some confusions about what are barriers and what are not barriers. And so this is an example of somebody putting a lot of controls in that they think make sense. They probably do, but they're not all barriers. Most of these are probably degradation controls, helping to avoid the degradation of a small number of actual barriers. So for all those reasons, we got together a few years ago and decided to try and help clarify how to do good bow ties, and we published this book in 2018. It was a collaboration between the Energy Institute and the Centre for Chemical Process Safety. There's confusion about who and what bow ties are for, no generally accepted methodology and terminology, And some typical problems were structural, not differentiating clearly between barriers and degradation controls, lack of rigor, confused description of what a hazard is and what a consequence is, incomplete barriers, things like that. And also human and organizational factors used in a very confusing and ineffective way. What this book actually delivers now, we believe, is it delivers a challenge to Bowtie developers and suggests answers to them. It asks people to think about who and why they're making them, and we give guidance about how to differentiate clearly, how to create and define a good barrier, and portray the way that those barriers can become degraded with the mechanisms of degradation, what we call degradation factors, and the controls over those that we can then put in place to keep the barriers strong. And it contains examples of poor and good practice, and it contains also the combined thoughts of a large number of experts. This is our team, and I won't stay long on this slide, but you might recognize some names and some organizations who were part of the development of the book. And we had a very extensive peer review as well with some heavy hitters on that. So let's quickly look at how we create a bow tie and what's it for. We start, the key thing is that it starts with understanding the hazard, defining the hazard, and how that hazard can be released and what the consequences would be if it were released. So it starts with defining the consequences and then moves to understanding the mechanisms by which that hazard could be released on the left-hand side. And so here's a standard picture. This is the way a bow tie is typically depicted using current software, which is there are two main software packages, Thesis and Bowtie XP, and they both look very similar and they're both very good. And this is how we would display and portray the bow tie typically. You can see two threats, threat 1 and threat 2, with their prevention barriers there, stopping the hazard becoming a top event. If it becomes a top event, then there are mitigation barriers in place to reduce or stop the consequences. Importantly, the barriers can degrade, and you see on the left-hand bottom of this slide a degradation factor defined with a control over that. So there's a degradation factor and a control on that. And we think that this way of portraying clearly the difference between barriers and degradation factors and degradation controls is very helpful. So one of the big messages we want to pass in this session, and we pass in the book indeed. So a good barrier on the prevention side is a risk reduction measure that on its own can stop the threat developing into a top event, and on the mitigation side, the right-hand side, can mitigate the consequences. A good barrier must be effective, independent, and auditable, and active barriers must have all three elements of detect, decide, act. Very quickly, what that means is that an effective barrier, you can see I've defined there, and independent, it must be independent with no common mode failures, and it must be measurable, so you can go and check that it's working properly. Active barriers must have all elements of detect, decide, act. That's really helpful to understand, and we put a couple of examples up there on the screen to help you understand what we mean by that. Okay, degradation control is different. It doesn't have to meet that full criteria, and it only appears on degradation pathways. So that's basically a very rapid introduction to what a bow tie is for and how it works. And we think that if they're done well, they really can improve how risk is analysed and how barriers are defined, better design of barriers, clearer definition between barriers and degradation. And so that's a better design of the risk management processes, really, and then implementation of those processes is improved by better understanding, which is a big part of why we do bow ties, is to communicate and improve barrier ownership. So somebody can be, really owning a particular barrier and making sure that they keep it strong. And finally, it also by understanding the current condition of barriers, you can get a very clear picture of your current level of risk. So finally, we decided to, as Mark said on the introduction, produce a bow tie, a personal bow tie for what individuals can do to minimize the risk to themselves and to other people of the COVID-19 pandemic virus. And so I'll stop there, and I'll just leave that up there for a second to because my colleagues Rob and Mark will describe this in more detail, but hope that was a useful introduction. Stop there.
Yeah, thanks very much, Charles, for taking us through the basics and leaving us with that graphic. So in the not the next presentation, the one after, Mark Manton will talk through that bow tie in detail, which is really the primary objective of this webinar. Now, passing over to Rob Miles. So Rob isn't actually using slides today, but I'll just give an introduction to Rob. He's an engineer, but also has got a degree in psychology as well. So a chartered engineer. He contributed to the EI/CCPS bow ties book that Charles just referred to. He currently is a member of an IOGP, International Association of Oil and Gas Producers working group, that's drafting guidance on contractor culture. He also contributed to the 4th edition of API Recommended Practice 75, for offshore operations. But for the Energy Institute, the key thing he's done is for probably about 15 years, maybe longer, been a member of our Human and Organisational Factors Committee, and has also served as a chair in that committee as well as writing guidance on contractor management, in particular in relating to shutdowns and turnarounds and multi-skilling and stuff like that. So Rob is going to take us through some more detail about the general aspects of bow ties, and over to Rob, please. Thank you.
Thank you, Mark. Can you hear me okay?
Yes, indeed.
Lovely. The first thing is that the bow tie diagram is predominantly a visualization and communication method. It can be used very effectively for analysis and particularly investigation, but it works best as a shared process when a group of people get around a diagram and discuss it. And in our experience, the best diagrams come when you involve a diagonal slice from management through to the frontline staff. We think it's very hard to do a good bow tie without involving the frontline staff, because they are actually delivering the barriers. So it's a shared process, and it evolves around consensus of understanding the threats and the barriers, and it's an interaction, an iteration in which gradually the bow tie is refined. Now, this particularly applies to the top event, the circle in the center, which is the point at which you go from planned to unplanned, the point at which you lose some control. It's not always obvious when you go from planned to unplanned, and that's where involving people and discussing that really helps identify the key moment when things transition from planned to unplanned. Now, when you go to unplanned, you're not unprepared, and that's important. You prepare, but you're not working to the plan anymore. On the left-hand side, you have the threats. These are the things that can upset your progress to plan, and they are always external. They're things that are done to you. Now, you may want to put in there mistakes you make yourself. Don't. These come in somewhere else. The threats are always external. There's an assumption here that you're doing your best, and if things go wrong, there's a different reason for it. The barriers must stop the threat, as Mark said. So if we look at the example of personal protection, a mask has to be worn, it has to fit properly, it's got to be effective. Those things together make one barrier. The same with washing. You can't say, well, I've got a sink and soap and water, so I've got 3 barriers. No. It's the soap and the sink and the water and proper washing and the time to do it, and that will give you 1 barrier. Now, that's important because when we look at these things, what we find is it's very unusual if you get more than 2 or 3 barriers. People start with an idea that they've got 10 or more, keeping them safe. Once you apply the rigor, you soon find you're down to 2 or 3. And that really helps people understand how close they are to losing control a lot of the time. Now, on the left-hand side, the barriers that prevent that loss of control and keep everything going to plan are very much around planned, prepared. They're the right way to do things. It's the normal way of doing it. And while you might be under a bit of time pressure, it's controlled and hopefully relaxed. When you get to the top event and you start to lose control and you transition over to the right-hand side, that changes. You're now going from planned avoiding a lot of control to recovering control. So yes, you're prepared. You may have rehearsed these things. You might have practiced them, but they're not normal business. They're exceptional. You're now under time pressure, and predominantly these right-hand side barriers are delivered at the front line where skill and experience really matter. A more skilled team will come up with more options for recovery. If you think of the face mask, you've gone to the shops, your plan is to have it with you and put it on, you park up, you can't find it. You've reached your top event, you're transiting from planned to unplanned. It's not a disaster yet. What you do in terms of what else you've got in the car, where else you can get a face mask, what else you can use, that comes in and recovers you back onto the plan. That's the key. The right-hand side stops the loss of control turning into a disaster, and most times that's what we actually do. We don't have a lot of disasters. Barriers on both the left-hand side and the right-hand side are not perfect. They degrade. There's no soap. The water is off. You can't find the face mask. So the threats that cause your barriers to fail are the really important things. These are the things where it starts to go wrong, and the measures you put in place to prevent that degradation are the absolute key to the diagram and the analysis. That's where all of the real work goes on in the bow tie diagram. It's all about preventing the frontline barriers from degrading and how you go about that. So if you look at these degradation factors, I forgot where it is, the soap ran out, the water got turned off. What you do about that, how you check in advance, how you remind yourself, those are the barriers to degradation. And when you look at incidents, or if you see when things have gone wrong, that's where you find what's really happened. It's not in the failure of the main defense, it's why something undermined it and why something designed to stop doing that didn't work. Now, your own error and frailty and mistakes made by yourself and your family or team members, they all go in there because you're intending things to go well, and for reasons sometimes outside your immediate control, they don't. And so that's where you get into the analysis of human error, mistakes, failures. They're in the degradations to the barriers. Now, the left-hand side is planned and the right-hand side is responding, and by and large. And one of the questions it's helpful to bear in mind is, think about where you spend your day. Do you spend your day on the left-hand side of the bow tie diagram with carefully planned procedures, avoiding any loss of control, or are you on the right-hand side responding to events and firefighting? Clearly, it's better to be on the left-hand side, but the reality is you need to be comfortable on the right-hand side. You need to be able to firefight. You need to be prepared for it when things don't go well. So your objective is to spend your time on the left-hand side, following procedures and plans, but you can't avoid finding yourself on the right-hand side, and preparing for that's very important. The best way to look at this is just to think, well, if the plan works, I can avoid the top event. Now, I think that's probably enough from me around the bow ties. You're going to need to go back to the diagram, and I think it's right for me now to hand back to Mark.
Indeed, and I think how you sort of set that out about putting efforts into the left-hand side, your day-to-day efforts, I think is very valuable, and also talking through about how degradation occurs. So I think that's very helpful. Now, in that as well, you gave some insights into some of the detail that is in the COVID-19 bow tie. So you're making a useful link to the next presentation. And so what I'll do now is I'll introduce Dr. Mark Manton of ABS Group. So thank you, Rob. So Mark spent 25 years with Shell around the world, including in Malaysia, France, etc. And his last role in Shell was as process safety manager at the Stanlow refinery for its divestment. And as part of that role for industry engagement, he actually worked with colleagues in the UK PIA, UK Petroleum Industry Association's Process Safety Leadership Network, which he chaired. And that was an interface between the industry and the regulators here in the UK, the Health and Safety Executive and the Environment Agency in England. And that was at the time after the Buncefield incident in the UK. And I do recall one of the things Mark produced a piece of work about the role of individuals in SIL 1 rated safety instrumented systems, and how a person can actually have a role in that system. So subsequently, for the last 7 years, Mark has been with ABS Group, consulting and delivering training on and offshore, and also to petrochemicals, pharmaceuticals, and engineering functions as well. He also participated in the development of the CCPS/EI bow ties book, and he's presented papers on that topic at AICHE's GPCS conferences in 2017, and also the hazards conferences run by IChemE. So at this point, over to Mark.
The important thing about all bow ties, before you actually do any work yourself, the key issue is actually working out who are you putting a bow tie together for, why, and how you're going to use it. So the key question with all bow ties is who's the target audience? After that one, the next question is actually who owns the bow tie. So who's going to be who's accountable for it and who's responsible for maintaining it. And then the third question, which is I think probably almost more important than anything else, is what's the business process you're going to have to use the bow tie? I have unfortunately seen a dispiritingly large number of dusty bow ties. By this, I mean that companies have hired in a consultant who's come along, and what you've ended up with are bow ties that then sit in a coma report or sit somewhere gathering dust. If you're going to use bow ties, work out how you're going to do it, how are you going to manage it, how are you going to use them, what forms will you use them? For example, one example I had was the site manager or the unit manager would actually pull out their unit's bow ties on, say, a monthly basis and go through one element of it just to refresh everybody about it. But if it's not built into the organization, they become sort of process safety people's wet dreams or something like that, or just that they become their fantasies rather than actually something that's useful. So it's really important to work out why you're doing it and what you're doing it for. So come to the COVID bow tie. Who's the target audience? The target audience is me. So the target audience is an individual. So we're not trying to tell companies how they should do it. It's not how the government should do it. The target audience are single individuals. So then the next question is who owns the bow tie? That is then, it stays with us, the team before, five of us who put this together. So we're the ones who have it. And how does it fit into the business process? I suppose the business process we have simply is sharing it with you. It would have been nice if we'd been able to persuade the government or somebody else to use this to help to a wider audience, to help people understand the concept of it. But we haven't succeeded there. So that's where we are today. In the details then, what do we have? We have the COVID-19, we have the hazard. What is the hazard? The hazard is the SARS-CoV-2 virus. It's not the COVID, but when we put this together, we didn't want to really go and use that complication, just use the COVID-19 virus rather than getting into the nuance of details. That's the virus. It's in the human population. So part of the you have to describe the hazard in a consequence. It's not the COVID-19, it's not the SARS-CoV-2 virus sitting in monkeys. No, it's in the human population. Then the top event. When do things start to go wrong? The things start going wrong when I become infected or actually contaminated. What will happen if the worst case scenario, then you take the hazard, you take the top event, you then go straight to what are the consequences? The consequences that are, and what we're interested in bow ties, are major consequences. So the one consequence is me dying. That's not something that will make me very happy. The next possible major consequence is that I'm actually going to cause other people to die. That's something that I don't want to have to happen. The third consequence actually is if I get infected, that is going to, the consequence that it will lead to is social economic damage. So I don't really want to be contributing to lockdowns continuing and messing up other people's lives so they can't go to work. So I have a role here. So me becoming infected will lead to that possible consequence. The other side of things, how do you get, what's the threats? The threats are going to be the virus is in the, is transported by the air. Since we put this together, there's been a lot more detail on spray droplets and whether it actually microscopic and the levels of it and things like that, but basically air transport. The other one is via surface contact. So if we then go into this in more detail, we look at the first, focus on there, and I'll drop these down. So if we're looking at transfer via the air, when we've sat and looked at this, essentially, you really only got two barriers. The one is stay away. So the example I always use is the lost tribes of the Amazon are not going to get COVID-19 because they have no contact at all with anybody who's infected with it. So this first barrier of self-isolation, I stay at home forever. I avoid gatherings, and I'm more than 2 meters from everybody. That then we're led to believe means that you will not get it, full stop. If you're able to do that, perfect. There are then, what might you not be able to do that? Well, there are two reasons why you might not be able to do that. One is that you actually need to eat. So if you have to leave the home to buy food, work, or seek medical treatment, so that is a factor that will cause that barrier to not do what we want it to do. And so what we then have are controls in there. And so these controls, you will be very familiar to you. You recognize them all. Minimize trips, avoid public transport, remote working, or government financial support. So I need to work. If you can work from home, that keeps that barrier good. If you need to work, you need to work to get money. Well, if you have government financial support, that keeps that barrier strong. And the third one is then also is to use deliveries and click and collect and use neighbors, etc. What you start to see here is these are the things that we get told about by the government. So the guidance we get. And in process safety management perspectives, this is your safety management system controls. Going back to the bow tie itself, the next one comes is that actually, I don't care. I'm reluctant to follow government advice to stay at home. So what are the controls we have there are peer pressure and interventions. And if that's the first control to try to make it work. If that doesn't work, well, then we go into regulation, guidance, and enforcement. So basically, you have a friendly Bobby coming and tapping you on the shoulder and giving you a fine. So those are to try and keep that barrier working correctly. The next barrier is PPE. The one area which this is actually developed on further since we did the bow tie, crucially here, the barrier here is actually going to be people who are already infected. So the advantages of that is that we'll come into it later, but if they are covered with PPE, how PPE degrades is there's the whole science in actually knowing how to put on PPE properly. There was a very good paper which the HSC put out about 12 months or more ago, in which they, prior to any of the COVID things, looking around the use of PPE in UK hospitals and the different types of PPE and the training that people actually need to have to actually get it to work properly. So that's a whole science in itself. If you don't get it through the air, you might get it from contact. So somebody with COVID spits on their hands and rubs it on a handrail or a surface. That's potentially going to cause you to become infected. How do you avoid that? Same one as well. If you never go out, if you never go anywhere near anyone who's had COVID, you're not going to get it. So that's very similar to the one above, and we have the same degradation factors there. The next one is that if that fails, you go out and you actually touch a surface. So you try not to touch surface, but if you do, then the thing to do is to get it off your hands as fast as possible and not touch your face. And the third barrier here would be regular cleaning. But why will this barrier not work? So regular hand washing, not touching your face, things. So one area there is, so one area it's going to get you is you actually, if you're like me, you keep touching your face. There's this agony going out and about because I'm constantly now thinking I want to scratch my nose, but actually I've been out and about, so I shouldn't scratch my nose, and then it becomes a perpetual cycle, goes around, drives me nuts. But what is the thing there is what are the controls we put in place for that? Is we keep getting told, reminded of it, and then also we have colleagues who will help us on that. Another way around it actually will be face coverings. If you've got a face covering in front of your face, you can't touch your face because you've got a physical barrier there. So the idea of face coverings will help avoiding this issue here, that you actually won't contaminate yourself because you can't hit your nose. You can't pick your nose through a face mask. Then the other one is inadequate hand washing, and there we've had then the training, which has certainly affected me. I wash my hands more than I ever used to. As a consequence, now I keep on using Savlon to try to keep the hands dry or moist because they keep on cracking like buggery. But so that's a change that I've experienced. So those are the barriers that we have on the left to prevent us getting infected. As an aside then, so what's the point of bow ties? Well, since putting this bow tie together, what it really strengthened for me was, yes, I paid all the attention to all the news and everything else and got a certain amount of overload there, but realizing basically it all comes down to bloody self-isolation. If you don't self-isolate, that's the only barrier that really works. It works there and it works there. So if I stay away from everybody so when I go out walking now, certainly in the area, I end up with kissing gates. So I try and open the kissing gates with my elbows and things like that to avoid touching my hands. So I've changed my behavior for me personally because realizing that self-isolation is where it's all at. Then, so this is the side that I can really affect and I can change and stop me being infected. However, if I am infected, then 3 legs will come in, and this then becomes more generic. But my death, what can affect my death? Well, the first one is if you have gained, if you've had it previously and you've gained immunity, or you have natural immunity, or when available, vaccinated immunity. That will be a very good barrier. So in terms of so the people who are asymptomatic, that will be a very good barrier that will stop this threat line leading to their death, because it'll stop there. That barrier will stop them having any effect. Closely related to one, though, is if you don't have a natural immunity, that you do have a response to it. If you're in a low-risk group, essentially, the glib summary of it is young female with a non-compromised immune system. That puts you in the best risk group for stopping this threat line leading to death. If you don't have vaccination, you don't have immunity, you're then stuck with just medical treatment until the body fights off infection. And that does or doesn't work. What can help that to work is my death. So what will cause medical treatment to not work would be that the medical staff run out of doctors. So what do we need in there to get that to work? We need to have antigen testing and things like that. So the doctors, the medical staff can go back to work. And the other way around, it would be the overloaded medical system, which you need more hospitals and capacity. So certainly this was the Nightingale hospitals came in the UK, came in here, which were basically a la minute hospitals to meet the capacity demand. The next one is other one that actually, I don't want to die, but I don't want to kill other people. So what is it that if I become infected, what is there to stop me touching other people? Well, the flip side here is I'm not infectious because I've been vaccinated. So even though I become contacted, that won't stop me passing it on. Another one again is minimal contact and isolation at home. And here we get a, so that's one to stop this happening. We have the same one as on the left-hand side, reluctant to follow advice. That's no different there. I need to leave home to buy food, etc. That's the same as previously. But what we now have here, though, is this another one that will stop that barrier from working, is I'm infected, don't realize it, so I don't minimize contacts. And this essentially is then the testing and tracing. So this is how the whole testing and tracing fits in, is because if we can, people who aren't infected, the issue we really want to do is stopping the further contacting and killing other people. So that's where that fits in. And the last threat line then here is the protracted lockdown, similar to the previous line, but there's actually antibody testing when it's available and vaccinated immunity. We've had that before. Similar one, but reduced numbers of people out and about. The barriers are slightly different here because we have the similar one to above, symptomatic people not isolating, and that's then peer pressure, guidance. We can add in then the idea of temperature measurements of everybody as they go into restaurants and so on. Then we have the contact testing and tracing issue here, that testing of individuals and then tracing to quarantining infected individuals, that comes here as well. We then have another additional degradation factor here, and that is reintroduction from other regions. So we have the wonderful idea that travel bans until antibody testing is known, or quarantining. So the UK is wait until the horse is bolted, and then we'll introduce quarantining, but that's a separate issue. So what we have here is then an overview. So if I go back up to here, what we then get is then, this is the end-to-end picture for all there is about all the thousands of words and the millions of words of newsprint and the rest of it. That's what it is. That's the end-to-end picture for COVID.
For everyone's benefit, we will shortly have a Q&A session, and we have had some questions submitted, but just note that what Mark did there, he was just to introduce Amaya. Amaya is actually an ecologist. She joined EI about 2 years ago, and she provides technical support driving the development of safety and environmental projects across EI's technical development program. In particular, she supports the Stichting Tripod Foundation, which of course is the guardian of the Tripod Beta methodology. And of course, fundamentally, Tripod Beta uses a bow tie approach. So she's going to lead us through the Q&A session, which will actually start with more Mentimeter polls.
So thanks for that, Mark. So just to start the question and answer sessions off, we've got a couple of Mentimeter questions. So in order to answer these, you just need to follow the same process as we did at the beginning. So using the app or entering www.menti.com into your web browser. And I can see that a number of you are already coming in with your answers. So this first question is, what is most effective barrier to prevent you from becoming infected with COVID-19? Okay, so thanks for that. So you can see now we've got a lot more people answering separation over PPE. Mark, is there anything that you'd like to comment on with these results that have come in?
No, I think it's I think I hammered home the message. So, and I think it looks like it's been heard. That's the crucial thing. So, what I hope everybody does take away from this is that if you don't want to get COVID, stay away and do whatever it is to keep your 2 meters, do everything else from it. Because I am as well. I am now. I'm not yet in the risk category, but I'm getting very close.
So question number 2. Will face protection help to stop you becoming infected from someone who is shedding COVID-19? So maybe was the highest answer that came out this time, but there were quite a lot of no's that came through as well. Mark, what do you think about this one?
Yeah, I think most people spotted it as a trick question because it's not clear. The maybe is if they are wearing the face mask, then the face protection, then it'll stop you becoming infected. If you're wearing the face mask, it ain't going to help you at all. So that's the big difference, because face protection to going to your local Sainsbury's will stop the other ones from infecting you, but it won't actually stop you being infected. You'll need a triple FP mask or a P95 mask, etc., etc. But you can't use those if you're a person like me with a beard because the damn mask won't work properly, etc. So that's the answer there.
Thank you, Mark. Next one, Francesca. So we've got 4 of these, I think. So this is number 3 of 4. So will face protection help to stop you infecting others in the event you become infected, even if you have no symptoms? We've got 1 minute again to collect answers.
That's pretty unanimous then.
Yes.
Which is, as we've been hearing, and they're downstairs, but my partner's been making face masks at home, just not face protections, not masks. We need to differentiate correctly here, according to the government. So clearly, it is that if you don't have any symptoms, you may well be shedding even if you don't have any. It's sort of analogous. I always think of, was it Typhoid Mary was the classic case of the was 100 years ago, that she was killed half of the rich American families who she went to be cooks with because well, she had no symptoms, but she was full of typhoid. So it's the idea of asymptomatic and harmful, definitely is with COVID as well.
Thanks, Mark. Right, so on to the last one. So would safety risk thinking, tolerability of risk, harmful event frequencies, etc., be beneficial in communicating the pandemic risk? And Charles, I'm wondering if you want to have a go at commenting on the results that you can see coming through for this one.
Well, it's certainly interesting that we've probably got a lot of engineers and people involved in safety on the call, so we all think that safety risk thinking is a good idea, perhaps. Some people will be unsure. I'd be interested to know, as Mark just said, what the thinking is behind the no's. But yeah, it's a clear picture that a better understanding of risk generally will help in understanding this particular risk.
Thank you. Rob, have you got any comments on this one? Any thoughts?
Yes, I think it will help, but we do have to strip away some of the jargon that we use in the hazardous industries to make it accessible, because I think the principles behind it really do help, and the discipline of separating out threats, loss of control, hazards, but we're steeped in that kind of language. We've got to make it accessible, and then I think it's valuable to everybody.
Thank you. Okay, so that brings us to the end of the Mentimeter questions. So we're just going to move on to some general Q&A questions now that I've been collecting from you guys throughout this presentation. Fortunately, I couldn't get through all of them, so I've tried to pick those I've tried to avoid duplication and pick those that I think everybody will be interested in finding out a bit more about. So if I start off with a more general one, Rob, I'm going to throw this one at you, so here it comes. So the question from Stephen Griffin is, do you risk rank the consequences? Can you use a bow tie to risk rank consequences of individual threats?
Not easily, because the problem is once you reach the top event and you go from planned to unplanned, things can spin off in all sorts of directions. So if you take the example of an operator on a refinery making a mistake, they might hurt themselves, they might hurt their colleagues, or they might blow the whole refinery up. You can look at the consequences, but the problem is there's not an exact relationship between things not going to plan and exactly how they go wrong and where that leads to. Really what you're interested in is having good, strong right-hand side mitigations with experienced people and rehearsals so that they get in and they get in that space between the top event and the consequences.
Perfect. Thanks, Rob, for that answer, and thanks, Stephen, for the question. This one will be for you, Mark. It's more specific to do with the COVID-19 barriers that you were just showing us. So this question is coming from Ian Travers, and the question is, given the uncertainty of the effectiveness of control measures, apart from total isolation, for prevention of transmission of COVID-19 in a return to work scenario, how can any barrier meet the CCPS definition of being on its own, being capable of preventing a threat causing the top event?
You're right. The barriers are, but the idea is that a barrier by itself has to be able to stop the event. Barriers all fail, and that's a work that we're quite happy with that. So typically, in a type of LOPA scenario, we're looking for a PFD of 0.1. So a barrier should work 90% of the time. So we're not expecting the barriers to work 100%, but if they were to, the idea is if they were to be working, they would actually stop it. So isolation, it will actually stop it. It will degrade. So therefore the guidance should then be, you're stuck then with the 2 meters and trying to go with the guidance there to keep that barrier as solid as possible. On PPE, if you're then, that gets into the whole idea is if you're in the medical fraternity by definition and you're treating COVID patients, the first barrier is gone. It's long gone because you have to be right up close and intimate with them. Then the only barrier you've got is then PPE, and then you're into the P95s, the FFP2s, which therefore demand the appropriate training to make sure you can actually use the damn things properly and you know what you're doing. You're not just an amateur putting on PPE. I guess. So yes, the barriers do meet the CCPS guidance requirements of actually being able to stop it, but they won't work all the time because they will fail 10% of the time each or something like that.
Perfect. Thanks, Mark. Thanks, Ian, for that one. I think we've got time for just one more question, and then I'll hand back over to Mark Scanlon. So the last one is going to be for you, Rob, again, if that's okay. And the question is, the first version of the bow tie was developed a couple of months ago before the peak of cases in many countries. So how applicable is the bow tie now, as in some countries there is some easing of restrictions and a move to return to work? Do any of the barriers or degradation controls need to change?
And I think it's a really good question. And the point about this is these diagrams are dynamic. So broadly, the structure of the bow tie we have at the moment, I think, is correct. Will it need to be adjusted? Yes. And the way we promote this is that you should take this and print it out, scribble all over it, edit it, and adapt it in the light of what you see going on. This is very much our first attempt, and we do think it will change. What you might also do is say, well, I'm going to take out some of the barriers because the situation is changing. They're no longer effective or operational, or they can't be delivered. For example, the separation. What does my bow tie diagram look like now I grey those out? Am I still okay, or am I moving to a place where actually this is quite dangerous? So it's very much dynamic, and we advocate pasting these things on a whiteboard and getting some marker pens because they are live and they change.
Perfect. Thank you, Rob. Mark, have we got time for one more that I can throw at Charles, or shall I hand over back to you?
Well, maybe is Mark Manton, by sharing his screen, does he want to say something?
No, it just filtered in. It just seemed like a good thing to do.
Okay. So what I suggest to Maya is we close off now. So thank you very much for leading us through that, because we will end up being about 10 minutes over overall. So as a kind of reminder to all the delegates on this webinar, do go and look at the reference document, which contains Mark's got on screen there. But Francesca, if you put the resources back up again, these will be listed in the debriefing email that will also contain a link to either hear the webinar again or to share it with colleagues. Noting at the end of this, there are other resources that we haven't talked about. In particular, there's a reference, number 4 there, to a piece of work that's been done under EI's Health Committee about returning to work effectively. There's a very good resource there from CCPS about risk-based process safety in disruptive times. That's published on the CCPS website. And Ian Travers, as well as asking questions, has been busy writing guidance for the benefit of industry and commerce as well, thinking about how those measures would actually work or not work, and what you need to do to kind of reinforce them. As some of the speakers have actually said, they need to be in a management system, and Ian alludes to that in that guide. The final thing on that list is there's a set of resources hosted in Australia by an organisation called Safer Together, really a workforce organisation, which is a bit like Step Change in Safety in the UK continental shelf. And they've operationalised information about bow ties into things about keeping a distance and stuff like that, with short videos and briefings. I also know that IPECA have got resources, and even within EI, the Safety on Wind group also have resources, as well as Toolbox, the EI hosted incident learning system, has got a learning based on a real COVID-19 incident on an offshore installation, actually in the offshore wind sector. So they're really just resources going forward. So do consult them, and really now it's just a few closing remarks from me. And the first thing is to thank all the people who took part today, speakers, and also Maya for leading us through the Q&A session. Martin Johnson of BP, who helped put the bow tie together, who's not a presenter today, and Stuart King of EI, who also took part in one of the working group meetings. I'd also like to thank the EI events team for facilitating this EI live event, and also for everyone on the call today. So I hope you've all learnt something, and for me, the sort of key messages to take away are: use the bow tie that has been published. When you create any bow ties of your own, align them to CCPS/EI book. Bear in mind that book had a lot of sweat equity from a range of people to try and get consensus on the methodology. Get in touch if you think there's something you think EI and or CCPS also should develop. Just keep mindful that there's only a few real barriers, and lots of ways that those barriers can be compromised or degraded. And also do integrate any of those barriers into your safety management system. And I think the final message is stay safe, because it's also your responsibility, not just your employers. So if you've got any comments to send to the event team, and before you drop off, you could of course put them on the WebEx system. There'll be a link that comes out separately with the debriefing email. So thank you very much for your time, and do join another EI Live event, or one run by CCPS or one of the other partners event today. Thank you very much, and goodbye.